welcome to the last in my mini-series of the Inside Knowledge for people with IBS about managing digestion through your lifetime. I've spent the previous 4 episodes talking about IBS through different stages of our life, and today we're talking about IBS in older people. I'm going to focus on the over 65s, but I just know there's a huge difference in people who are 65 to people who are age 90. This episode will cover a little bit about how the gut might change as we age, how you can best support a healthy digestion, key nutrients that are important for healthy aging, and a few examples from people I've worked with. Hello, welcome to episode 89. Of the Inside Knowledge podcast for people with IBS. I'm Anna Mapson. This final episode in my mini-series about IBS throughout your life is going to be all about people who are over 65 today, older people. Now, when you do a search for IBS for older people or healthy diets for older people, it quite often will come up with information about nutrition for people who are in nursing homes. And I think that feels a little bit off-putting to somebody who's in their late 60s or 70s, who's nowhere near going into a nursing home, but still wants information about good gut health for older people. So a lot has changed, I suppose, in how we think about those years of our lives. So from 60 upwards, people used to be quite old. As soon as they got to 60 or 70, they were a lot less active. Whereas now people are still traveling the world, maybe going on adventures, doing marathons or being very active. Often people also have to work quite a lot later in life than we used to. So really old age seems to really be more appropriate for sort of 85 upwards, whereas people who are 65, 70, 75 are actually still pretty active, still involved in their community, often looking after grandkids, helping out. So I think the information that can be found on the internet is sometimes a little bit outdated in terms of, older people and what we actually mean by that. When I did some research for this, I was thinking about gut health. So I'm going to talk a bit today about gut microbes and how they may change over your lifetime, because we do have a little bit of research about that, but also some of the factors which might be influencing your digestion. Generally in the world, we have got a global aging population, and I think by 2050 there's going to be 16% of the entire world will be over 65. So generally there's a lot of aging, particularly in more industrialised countries, less children per family. So as well as the way we think about older age and how that has changed over the years, and the fact that more people are living for longer, we have got this increasingly ageing population. What you may find is that if you've got IBS symptoms, they can change as you get to this stage of life, and this is for a variety of reasons. Sometimes it's change of lifestyle and dietary schedule, like you're eating in a different way. Could be to do with lack of activity, so the more mobility issues that you have, you're going to become more sedentary. That can lead to changes with your digestion, and also having weaker muscles just through lack of activity will also affect your gut motility and overall functionality of your digestive system. And then also we've got complex medications, sometimes called polypharmacy, where you have multiple medications. You take one medication and then you need something else for the side effects of that and something else for the side effects of that, and it gets quite complex. But all of those may play into our digestive system as well. I thought I'll just start with some of the changes that can happen starting with our mouth and working through the digestive system, and then looking at the whole body. I wanted to start off with teeth as well. As we age, often people can get more and more problems with your teeth. Obviously, you've had more years of not perfect brushing, more exposure to acidic foods or sweet foods that are going to increase the amount of bacteria. As an example, my grandmother was born in the 1920s. And when she was in her 20s, so in the 40s sometime, she had some problems with her teeth and they just took them all out. So she had false teeth from a very, very early age. And I think they used to do that all the time. They would just whip out your teeth if there was a problem because it was easier to have dentures. So obviously nowadays that's not such a common practice and people really will maintain their normal teeth. However, Lack of teeth, particularly the back molar teeth, can impact on your food choices. So perhaps if you've got some wobbly teeth or you've got some teeth missing towards the back, you choose foods that are less chewy. And if you think about what they're going to be, it might be meat, it might be crunchy vegetables, because the teeth near the front maybe are better, but you can't mash up your food as well. So those kind of dental problems may have an impact on your food choices, which can then influence your digestive system. For example, if you're eating less protein and less meat, maybe you're eating a higher carbohydrate diet, that can have a knock-on impact on metabolic conditions, such as high cholesterol, weight gain, those kind of things. We're slipping our diet out of balance due to restrictions on what's possible. So some ways around that might be to get a slow cooker and have slow cooked meat that's really soft. Also to choose high quality protein that is also going to be easier to break apart. Things like fish are really good in that instance because they're much easier to break apart. If we move down towards the stomach in our digestive system, sometimes people have problems with stomach acid as they age. Now, over 65s, it's quite common to be on a proton pump inhibitor, which is an acid suppressant. Listen to episode 62 and episode 63 if you want to hear more about managing acid reflux and the impact of using a proton pump inhibitor, such as omeprazole. But it is common in the over 65 population to be on stomach acid suppressing medication. That can have an impact on your nutrient intake and also the potential for you to get changes in your gut bacteria. So changes in your small intestine with the possibility of overgrowth, SIBO, or changes in the large intestine even. So what we want to do is try and make sure that your digestion is as strong as possible. And so if you can avoid going on those medications because you don't have such bad acid reflux, that's the position you want to be in. However, if you are on them, as I say in the other episodes, don't come off them because you're worried about them. It needs to be a conversation with your doctor. But it's important to think about why we're getting those problems in the first place. So acid reflux can be a cause of having a larger torso, like being overweight. That can put pressure on the sphincter, and sometimes people will put on weight as they age. I spoke to a client the other day who said, I've heard people put on 2 pounds every year once they get past 60, and it's impossible for me to keep fighting off the weight. So it is not a given that everybody will put on weight as they age. It is still a balance of energy, how much you're burning off and how much you're eating. So where you feel that you are overweight or you want to lose weight, there are still things that you can do. Now, yes, sometimes it does become harder because you maybe have less mobility, like you have less muscle strength. But it's not a given that everyone will put on weight as they age. If you're someone who's had IBS for a while though, often the opposite is true, that actually you may be underweight, under-eating, and as we age, sometimes people find that they get a lack of appetite. So the things that they used to be able to eat, their appetite starts to decline. For some people that's not a problem, but if you're already in a very small body and your appetite is declining, it can be really challenging. Listen to episode 50 about how to gain weight when you have IBS, and I did another episode about appetite and how to encourage your appetite when you don't know what to eat. That's episode 51. That will help you with some tricks to increase your appetite, but essentially you're looking for flavour, things that you love, like increasing the amounts of those foods, because restoring a healthy weight is one of the ways that you can help your digestion. If you're under eating, it's very likely that you will bloat every time you eat. It's likely that you will feel gassy because your digestion motility is slow. It's likely that you will feel stuffed and uncomfortable because you're not used to bigger meals. So it's common when you are under eating and you start eating to feel some discomfort, and that can be managed when you take the long view and also when you know exactly what kind of foods to introduce. So what I'd say is focusing on ways to encourage your appetite is more about getting flavour, like high energy foods that are actually going to help you. If you are someone who suffers with constipation, then go back and listen to episodes 33 and 34, because in there I talk about the causes of constipation, and one of them is a lack of movement, being sedentary. as we age, typically people do stop moving around as much. Maybe you've retired and you don't spend as much time moving around at work. You have more days where you're relaxing, doing what you like. That could lead to a lack of muscle building or even muscle wastage. Now, accompanied with a lack of sufficient energy, that can lead to sarcopenia, which is muscle wastage when you're kind of fading away. We don't want that. We want you to stay strong and healthy long into your old age. So increasing the mobility that you have by keeping active is one of the best ways to do it. A good way to do it would be to find exercise that you actually enjoy. So if your knees hurt, for example, maybe you can go swimming. That takes the weight off, but still can be a very good aerobic workout and can be actually quite relaxing. If you enjoy being outside, maybe you can take up cycling. Again, less pressure on some of your joints, and it means you're getting some fresh air. Sometimes people who love to do things socially, maybe you want to do a Zumba class or some weights classes at your gym. Some people, again, it's like getting a personal trainer when you need that accountability. Like whatever it is for you, finding the thing that keeps you active is so helpful for your digestion, because not only does it help us burn away some of the stress hormones, so really helps with anxiety, but it also just gets your gut moving. So especially if you're someone who suffers with constipation, that can be a problem as we age. But again, it's not something that everybody has to have just because they're getting older. It's about trying to keep all your systems going as much as you can. We know that IBS is a disorder of the gut-brain connection. So it's well known that there is a significant psychological element to IBS. It doesn't mean that you're making it up. It doesn't mean it's all in your head. But what it does mean is that your thoughts and your feelings, and then the behaviours that ensue, and also chemically what changes in your body when you have these feelings and these thoughts, physically changes your digestive system. It can speed your digestion up. It can increase acid production. It can give you those butterfly feelings that make you need to dash to the toilet. These are clear changes that are associated with IBS that are all down to how we're thinking and feeling. Some people who grew up 70, 80 years ago may have, I'm generalising here, not everybody, but may have a bit of an attitude of like, I should be okay, I should be able to manage this, and I don't need to spend time talking about my feelings or talking about how I'm managing or whether I've got anxiety. This may be like a cultural thing. For when you were growing up, it wasn't okay to talk about your feelings. It wasn't acceptable to have anxiety conditions. It wasn't the done thing to be depressed. People just had to get on with it. And for whatever reason, those feelings have been internalised. And so what I find with some of the people I've worked with who are older is that it's less accessible to them to try things like breathing practices, to do yoga, to engage in counselling or therapy, and that's just because of how they've been brought up. So I also wanted to acknowledge that there is a potential for some of the the thoughts and feelings that we've had throughout our lives. And maybe if you're a real warrior, someone who just likes to hold everything in and not make a scene, that is quite difficult to talk about your feelings, and maybe that is also contributing to some of the symptoms. But again, I don't mean like you're making it up or that it's in your head. It's just that there is a real connection between the gut and the brain and how we're thinking, and that may be one of the driving factors that perpetuates your IBS. There's a few gut health studies that look at the changes in our gut microbiome as we age. We know that when babies are born, like the first 3 to 5 years of life, our gut microbes are really adjusting to the environment that we're brought up in, the diets that we're eating, and interactions that we have with other people. That really shapes your gut for the first few years of your life. Then our gut microbiome will be relatively stable throughout most of our adult life, from age, say, 20 to 65. Then what they have seen in some studies is that there are some slight changes in gut microbes as we age, and we don't really know exactly what that might be down to. But we could make a few guesses that it could be down to change of diet. So like I said, if you've changed your diet because you're changing your routine, maybe like I said at the beginning, worried about what food you can eat because of dental problems, Maybe you have changed financial positions as well if you've retired and don't have access to the same foods that you had before. These are really important factors. What you're actually eating. Has your diet changed? That influences your gut microbes, but also potentially things like your exercise habits. So if you've become less active, that can also affect your digestive system. It's slowing down your gut, giving you more likelihood of being constipated. There is some sense that maybe our gut microbes will affect the speed at which you age as well. So there's this two-way crossover, as with most things in nutrition, that your gut is affecting the speed at which you age, and your aging and behaviours are affecting the digestive system. So potentially, we don't know this for 100%, but there are like suggestions in some of the literature that your gut microbes may influence the expression of certain genes, which then have a knock-on influence to your overall aging profile of your body. So keeping a good healthy gut microbes and a good collection of diverse gut microbes may be one of the ways we can actually protect ourselves against aging. And of course, the way we do that is through eating a good healthy diet, which also brings in all the good nutrients that we need. It's not just about getting your gut microbes into tip-top shape, it's about all the things that come with the foods that also feed the gut microbes are also going to be healthy for you. Some of the things that you could focus on in terms of a healthy diet for people with IBS in older age would be sufficient protein. This is really important to stimulate muscle growth. You want to keep strong muscles and you want to keep good muscle mass. This is important, especially as you age and you become less active. Whilst I 100% say yes, keep active, keep building muscle as much as you can, even if you don't and you're very sedentary, you still need to stimulate muscle growth, which you can do through dietary protein. So keep eating meat, fish, cheese, protein from plant-based sources like tofu as well. All good sources of protein that you can add in every single day. And you can listen to episode 46 for a whole in-depth look at protein and how much you should be getting based on your body size. That's something to keep on top of. Also, omega-3 fatty acids, which you can get from oily fish such as salmon, mackerel, herring. Some of these included in your diet every week would be a great addition because omega-3 is very protective for our brain health and for cognitive function. So when we're thinking about aging, we want to try and keep a good, healthy brain. Getting some oily fish in a couple of times a week. If you don't eat fish, consider whether omega-3 supplements are going to be suitable for you. They're not for everyone because sometimes they can reduce blood pressure, they may interfere with blood thinning medication, so you do need to check whether it's suitable for you, particularly if you're on lots of other medication. Also making sure that you've got good sources of vitamin D throughout the winter in the Northern Hemisphere, because we don't have access to vitamin D, but sufficient vitamin D really helps you make the most of calcium from your diet so that you can retain strong bones, keep that going. So I definitely recommend, again, assessing whether you need to take vitamin D. In terms of things to reduce and take out, it's important to try and reduce salt in your diet if you are someone who likes a lot of salt. And I know that people who are around 70 now sometimes might have been brought up with a lot of salt, putting salt in your pasta water, putting salt in the potato water, adding a lot of free salts to our meals. And plus, now we eat a lot of packaged foods that also contain salts. We know that salt can be a driver of high blood pressure, which can have a knock-on impact on other cardiovascular conditions. So really important to keep an eye on your salt levels, and we should aim to hit below 6 grams of salt per day, and that is an upper limit rather than a target. The same with saturated fats, so making sure that we are not eating huge amounts of saturated fat and increasing LDL cholesterol, because we want to keep that low, making sure that your saturated fats are not too high, but that is a complex picture again that doesn't just build up overnight. You'd also want to really focus on fibre, making sure that you are still eating your 5 a day. That's still important, trying to get in 2 pieces of fruit, 3 vegetables, trying to keep up your healthy grain mix, like really trying to focus on all the healthy fibres that help keep your gut moving. It also helps to reduce cholesterol, can help to bind to bile salts. There's so many reasons why increasing your fibre is helpful. And maybe just thinking about the mix of fibres, that's what you want to focus on rather than just adding in things like bran or adding fibre that can be one of the triggers of IBS. Think about what fibres you can add, or fruits and vegetables you can add, that are just going to keep your bowels moving and also really help to give you a variety of nutrients. People ask sometimes, what should I be taking in older age? And should I be taking any probiotics? Because we know that there are these changes in your gut microbes as we age. The only sort of research that there is specifically about older people is mostly focusing on constipation, and there are a couple of strains of probiotics that have been shown to improve constipation in the older cohorts. So there was one which was using Lactobacillus paracasei, had 34 patients who were over 60, and taking that for a couple of weeks reduced their abdominal pain and improved their psychological well-being compared to a control group. Another study had Bifidobacterium longum, and Bifidobacterium, a couple of those strains are well known to help constipation anyway, but in this particular study it improved their stool and a couple of some of the upper abdominal symptoms in elderly patients who had chronic constipation. So probiotics may be something that you might consider, but it's not for everyone. I wouldn't say everybody needs to be taking it, and these were more particularly focused on constipation. I guess to summarise this episode, I just wanted to point out that generally IBS in older people is the same as it is for anybody else, especially as we think about older people actually being quite active and quite the same as people in their 50s, people in their 60s, 70s. They're not necessarily as old as we used to think of them. So the advice for you about a healthy diet or a healthy IBS diet in your old age is pretty similar to what I would say in most of my other episodes. So do feel free to pick and choose between any of the other previous episodes that may relate to some of your specific symptoms or some of your dietary concerns. So thank you for listening to this episode of the Inside Knowledge podcast. Better digestion for everyone.